Hey, welcome back, guys, to the Women's Health Podcast. Kim and Dr. C. Dr. C here. Kim, before we went out on break, where were we? We were talking about the benefits, the potential advantages, isn't it,
Right,
of
right.
cesarean delivery, right?
So we're going to get into the complications of cesarean sections or risk associated with cesarean sections.
Yeah, so we probably prefer to use the word risks because not every risk is a complication. There are some things
Right,
that are
right.
just inherent to that. So the first thing is to understand that this is a major abdominal surgery. You remember you mentioned about this is
Let's
major
start there. 8 layers deep. Let's start there.
We trivialize it, you know. So like I tell patients that, we talk about cesarean section and the risk of major complications is relatively low. But low risk does not mean no risk.
Thank you.
You see?
Say that
So which one?
again.
I mean low
We should
risk
put
does
it on
not
a
mean
shirt.
should, right? So low risk does not mean no risk. Okay. So every time, I go into a surgery, I know that there is a potential of complications. No matter how many times, you do surgery, there is always the risk of complications. And it's a major abdominal surgery. So for example, once you make an incision, it's going to bleed, right? It's not a question of is there going to be bleeding, it's a question of how much.
Right.
So one of the most important things is the risk of bleeding. And most times it's not enough to compromise the woman's health, but you can have significant hemorrhage from a cesarean section, and certainly the risk of postpartum hemorrhage is higher with cesarean sections than it is with vaginal delivery.
Vaginal.
And then you understand the fact that even though we're operating in a specific space and we're removing the baby through an incision in the uterus, the bladder is right in front of the uterus, especially if we're doing a lower segment cesarean section, which is the most common. The tubes that carry urine from the kidney to the bladder on either side are right lateral or right, not
Yeah.
far from where we make our incisions. The bowel is behind the uterus and above the uterus. So there is a risk of all of these structures being injured. And even though the baby, we said that it tends to be safer for the baby in terms of trauma, baby can be injured. There have been cases where incision is being made in the uterus and the baby gets cut.
Yeah. I've thought about that. I'm like, can't I just accidentally cut the baby well, make it an incision? I've
Absolutely.
thought about that.
It happens. It happens fairly, not frequently, but it can happen. I can't remember exactly what the quoted risk is, but we're looking at somewhere, it's under 1%, but it's still significant. Most times, however, it's not anything major,
Yeah.
but it can happen. So you do have the risk of injury to the baby from in the scalpel, or even while extracting the baby can be injured. So even though the risk is lower, it's still there. And then you talk about issues even after surgery. So infections, Kim, risk of infections is greater. You have a bigger incision there. You have the risk of blood clots, which is greater. So blood clots, when we talk about blood clots, we're not talking about clotted blood. We're talking about like deep vein thrombosis, pulmonary embolism, where you have clots in the circulation.
Right.
And that risk is high with cesarean sections, partly because of the surgery, but also after what happens afterwards, because you're not moving around as much, right? Remember we said that, you said that after vaginal delivery, you can get up and you can walk around. It takes a little while. Most women after C-section, by the following day, we expect them out of bed. But while you're doing the C-section, you're laying down on a table, not moving, and then afterwards, especially if you got spinal, and so it's going to take a while for you to regain function. So you're actually laying down for a longer time, right?
Right.
And so the risk of clots is higher. Although there are things that we can do to mitigate those risks, which we'll talk about.
Yeah.
So those are, some of the risks that we'll speak of, which are complications, but then you have non-complicated risks. So for example, we know that it takes a longer time to recover. We understand that during that period of time, even though when your tummy is healing and function are two different things, right?
Two different
So you know
things.
that. So you injure a muscle, even when the muscle is healed, it doesn't behave the same way.
Right.
You may have stiffness, you're going to have soreness. It's going to take a while to get back to where you were before.
Sensitivity issues.
Right.
One of the biggest complaints I get from C-section women, it's that they can't wear jeans pants after. like the sensation of having genes against their
Mm.
tummy. They can't manage it at all.
That's interesting.
That's one of the biggest complaints.
That's interesting. And it makes sense because, after you've had an incision in any kind of major incision, when we cut through the skin, we cut through the fat, we cut through the muscles. We don't, we realize, but patients don't realize that they cut through the nerves as well because the
Yep.
nerve endings are running in the skin.
Right. Right.
So what happens is you have a situation where and the tissues heal, but the nerve fibers heal very slowly.
Right. Very, very
That's why when
slowly.
somebody has spinal injury, a lot of times they become paralyzed because
Yeah.
it doesn't heal. Nerve tissue is the slowest to heal of all
Slow.
our body tissues.
Isn't it like 2 millimeters per week or something like that?
So I
It's
don't
very
remember
slow.
how much, but it's so slow. It's very slow. And
Slow.
so sometimes even years after a cesarean section, you may have numbness in and around the site of the surgery. You may have some occasional discomfort. Some people may experience some occasional shooting pains in the area. So you're right. And I can imagine if you're having something like, genes that's coarse rubbing on the area, it might be a little bit annoying, a little irritating.
Yeah. Yeah.
Interesting. Yeah. And there are risks related for the baby as well. We mentioned before about the fact that respiratory distress tends to be a little bit more common in
Yep.
babies born by cesarean section, especially if the cesarean section occurs before 39 weeks. And so therefore there's a higher rate of neonatal nursery care unit admissions.
Right.
And then of course we spoke about the microbiome, right, in
Yeah.
the previous episode.
So yeah, they have quite a few risks, as well as you have quite a few positives as well. But you know what I want to talk about that's often not spoken about is long-term complications. Like, what are the long-term well, I guess I can speak on that. The long-term implications of your muscles in your tummy not functioning properly. What are the long-term implications of that? So some of the long-term implications of that are like severe back pain because you don't have your abdominal muscles. You don't have your abdominal muscles functioning in the capacity that it needs to be functioning to help support your core. So then you now have more pressure on your back. So severe back pain that can sometimes lead to surgery. It's a very high complications for C-section actually. And because we don't have persons after C-section getting rehab, that education is never passed on. It's in a lot of cases, it's not even linked. It's now when we have pelvic floor physiotherapists who are seeing all these patients years after C-section and doing studies that were even making that link that a lot of these women is coming from the C-section that they did previously. Then when we see them with the dysfunction with the pelvic floor and they're like, oh, but I had a C-section. Why am I having pelvic floor dysfunction? Because the baby still was resting on your pelvic floor for 9 months. It does not eliminate damage to the pelvic floor at all. Yes, it does minimize some of the complications because you didn't push the baby through the pelvic floor, but the baby was still resting. The baby was resting on the pelvic floor as much as 9 months in most instances. So that can cause some amount of complication as well. Couple that with the fact that a lot of these women after C-section, their abdominal muscles are not working the same. So basically a core, it would consist of the anterior part would be your abdominal muscles, the posterior part would be your back muscles, and then the lower part would be your pelvic floor. So if you have 2 out of those 3 sections not working effectively for years, you can see you have weak muscles of pelvic floor compensating. You have weak pelvic floor, weak abdominal muscles, so back compensating for years. You can see where that will become a problem later on, right? And these can lead to other things like prolapse. So that's when the organs like falling through the pelvic floor. So the thing is, when you're thinking now in your 30s or your 20s about making a decision about C-section, you're not thinking about 60-year-old you. And that's why we're having this conversation so that you can think about all the things. So when you're making a decision, a C-section might still be the best option for you, even if it's not medical. Even if you just believe that this is a safer option and I want to go with that, that is completely fine. But now you'll know that if I choose a C-section, later on there might be risk and complications if I don't receive proper rehab. And if in most instances, women who are making a decision, they're usually in countries where they pay for C-sections, they usually have more money. So they have access to better care. That's just unfortunately how the world works. So they can seek out these cares for themselves so that they don't end up with these issues. And then for women who they don't have a choice but to do a C-section, they will know that, okay, I can still choose this choice and I can still be okay. They don't have to have the fear that, oh my gosh, Kim, my doctor C said there's so much complications from C-section and no, I don't want to do it. No, you can still have your C-section and you can still know the options that are available to you to mitigate these risks. Because risks don't mean that these things are going to happen to you. If you have the information, you can take the preventative actions to not let these things happen. But we can't do that without education. And that's why we're here, right, Dr. C? I think so.
Absolutely, absolutely, Kim. And I love that. There are three things I probably want to pick up from what you're saying. The first place I'd probably start is at the end, because you're pointing out the fact that ultimately it's not about whether or not you have a C-section or vaginal delivery. It's about making the best decision for you.
Right.
And for your baby at the time. It's understanding that, a well-performed C-section is not a failure, and vaginal delivery is not in any way superior to someone having a cesarean section. The goal is really identifying what's the right birth plan, what's the right birth strategy for the right patient, and having the right indication for making that decision. Because regardless of the decision you make, there are going to be advantages and there are going to be disadvantages.
Exactly.
And so it's very important to grasp that. And what we're really trying to do is to empower you with the information to help you to understand the pros and the cons, and also make the decisions that would be in your best interest, of course, with the guidance and support of your caregiver,
Right.
Your obstetrician, your midwife, etc. The other point I wanted to piggyback on was the first point you made about the back pain issue. Back pain is a very, very interesting phenomenon because there are so many factors that can cause back pain. And, you're mentioning about the effects of having, the abdominal wall issues, which can then lead to back pain. Because as you and I have spoken on many times before, Kim, the body is all connected.
All connected.
We make this assumption that, there's a problem here in my belly. It's nothing to do with my back. Or we don't realize that there's a connection between our organ systems. If there's abdominal dysfunction, it's going to lead to pelvic floor. It's going to lead to back pain. And I wanted to ask you how many times you've seen this, because I've had patients who say to me, Doc, they don't want to do a spinal because they're told that doing a spinal causes back problems. Spinal meaning spinal anesthesia.
Yeah.
Which is the most common form of anesthesia used for cesarean sections. So the question now is, and there's no evidence to indicate that doing spinal anesthesia causes back pain.
Right.
But could it be that the back pain is really a function of a result of the muscular dysfunction?
Yeah.
That
I would
arises
lean
from,
more to
and
that.
then they're really making association with the spinal anesthesia, not necessarily with the cesarean section. Or what do you think?
I would lean more to it being because of the abdominal dysfunction, or we call it functional core dysfunction. I would lean more to that than it being because of the spinal directly. And I've had women say that too. And I don't dismiss it, because right now we don't have the data, but years down the line we might have data that supports this. So I don't dismiss it, but working on, even for women who they come in and say that's the reason, working on core strength, working on the pelvic floor does seem to cause some relief. So I would still lean more towards thinking that's the reason versus the actual injection.
Yeah, that's interesting, and it's very important. So what we really need to be talking about is what we've been saying all along, that women who had cesarean sections need to have physiotherapy early, so that we can mitigate against the muscular dysfunction.
Absolutely. The average time a woman gets pelvic floor physiotherapy after C-section is 42 days. That's over a month.
And that's in countries where it's provided, Kim.
And that's
because in most countries around the world, women are not provided with physiotherapy.
In Jamaica, I was not seeing women until like
years later when they have problems. That's true for most countries, I would submit to you, especially developing countries. That's true. That physiotherapy is not a part of the management at all.
At all.
Until problems develop.
To be fair, in the Jamaican public system, I did see probably 3 or 4 women while still on the ward just delivery, but that's rare. That's
That's
rare. I
rare.
know I'm in a first world country and I've seen probably 5 in a year.
Wow. So it's not that big a difference anyway.
No, it's not. But that's in hospital. So I don't know what's happening once they leave, but that's in hospital.
So
And it's usually because, and the only reason they call physio is because they need the bed. They don't call you because, oh, women should get
they get them
physiotherapy
home faster.
after. It's like this mom had her baby 3 days ago and she's not walking. Now we're calling physio.
We need to get
Need
you
to get you
mobilized so we
home.
can get you home.
Yeah,
I mean,
that
which
is
is
pretty
good,
much
but we
it.
want to do a little bit better than that.
We need to do a little bit better than that.
The
Yeah.
third thing that because we're gonna have to wrap up soon. So the third thing that you had mentioned, which I wanted to just highlight on, is the fact that cesarean section does not prevent pelvic floor dysfunction. Because one of the things that drove certainly back in the early 2000s this move towards women selecting to do elective cesarean sections was the idea that they could reduce the risk of pelvic organ prolapse and reduce the risk of continence issues down the road by doing a cesarean section. And there are aspects of it that may reduce the risk of certain things because, as we mentioned before, you're not going to have the tears and so forth. But it doesn't eliminate. It's very
Nope.
important for women to understand it doesn't eliminate the possibility of having pelvic floor dysfunction because, as Kim just said, there is still that effect of the pregnancy in and of itself that affects how the pelvic floor works.
And then there
You're
is the
carrying this
abdomen.
weight on your pelvic floor for 9 months.
9 months.
Your pelvic floor literally holding up everything. The compressive effects do have a long term impact. So very important that you made that point, Kim.
And then we want to also point out the scar tissues from the incision, as well as the implication on the abdominal muscles. So, two
Yeah,
two
for C
major,
sections, you're
yes, for
referring to. Yeah,
C-section.
scar tissue. I said that, and I said this to patients all the time. Healing doesn't mean function. So a lot of the
No.
times we'll say, okay, 6 to 8 weeks, you'll be well healed up on the inside. You can start doing everything you'd normally do before. But that's not always true because when you start doing what you normally do, you're going to find that you can't do it the same way.
Yeah.
You may have some soreness. You may have because stiffness, because there's scar tissue that needs to be broken down and needs to be mobilized, and it takes time for your body to do that, especially without physiotherapy.
And it changes how you move. And once you change your movement pattern, then you have the risk of pain and complications elsewhere.
Yeah,
So
absolutely.
these are things that you also need to consider.
Yeah,
And not in a way like, no, I'm not going to do it because of this, but in a way of, oh, because this can happen, I can now seek that help out. Right?
absolutely. You're
So,
empowered. You
yeah,
know how
you're,
to prepare. You know how to plan. Yeah. One of the last things I'll do before we wrap up is in reference to the young lady who wrote in that started this conversation. And thanks to her once again because that was,
yes.
sharing her story is really giving us the opportunity to talk about this issue. But one of the things that she mentioned was that her mother was saying if she's running from pain in choosing to do a cesarean section, is that you're afraid of some pain. The vaginal delivery is a lot different in the 21st century than it used to be. I mean, we have very effective means of managing pain during labor. So avoidance of pain should not be a reason in this day and age
Should
to
not.
decide to do a C-section because we have very effective pain. And another time we can do a show where we talk about pain management during labor, Kim.
Yeah. Yeah, we can definitely
But there are options there that you can literally labor most of your labor without pain at all in this day and age.
absolutely.
So it should not be a reason. And you also have to remember that with a cesarean section, you may not have pain during labor, you
During.
may not have pain during surgery, but you have pain afterwards.
You're
And
gonna have pain
and you're gonna
afterwards.
have pain during your recovery.
Yeah.
So let it not be that that's just the only reason.
Yeah.
Yeah,
And to answer the final question, isn't a C-section safer? It depends.
it
That
depends.
is the truth. It
Absolutely.
depends.
We can
It
answer. Yes, I
depends.
love that. The answer is it
It
depends.
depends. And this is not just A versus B. This is medical options for delivering a baby. There are treatment options, and treatment options are based on the individual's condition. That is it, not your culture. You can't have dead people bullying you into choosing an option because for centuries they've been choosing this option. And you can't just run away from an option just because it seems scary without the facts, without the information, without what's available to you. So if pain is the fear, then we talk about pain mitigations. You might still not choose them, you might still choose a C section, but at least you would have done so with knowing the facts. That's all we ask.
Yeah.
And yeah, that's it.
Well, it was great, Kim. I enjoyed that show. I enjoyed
Yeah,
that
I did.
discussion. So we're gonna provide some information for you guys. We're probably gonna
Yeah.
put something in the link below, some probably a
Mm-hmm.
handout or something that you can grab on to get an idea of some of the points that we have discussed here.
Yeah.
But thank you so much for tuning in. And we want to wish you all the best. Until next time, stay happy, stay healthy. Goodbye from Dr. C and from Kim. Bye, Kim.
Bye.